All right, what's up, everybody? Week 4 here. I'm going to recap week 3. I want to do some anatomy. This is actually the third time I've tried to make this video, so I'm really committed to this. I just want you to know that. I'm going to do some knee anatomy. I want to show you knee anatomy. I want to show you knee special tests. Talk just real quickly about hip anatomy, and then show you some functional hip things that I want to show you that relate to that article that you guys have just presented on or turned into me this week. All right, so let's get right to it. I got Jordan's knee here. He's going to help me out. And these sexy tan thighs here. So, all right, here we go. I want to basically start out by showing you palpations. All right, what we mean by palpations is anatomical landmarks that I am feeling around with my hands. So that's when somebody comes to me with an injury. I'm going to ask them questions. How did you do it? What happens? Where does it hurt? How bad does it hurt? And then I'm going to get into palpations. So if his knee hurts, probably the first place I'm going to palpate is not going to be his knee, all right? So if he's saying, my kneecap hurts really bad, I'm not just going to jump right there and be like, right here? Because we want to build some trust, all right? The way we do that is by palpating around the injured area, working our way to the injured area. These palpations will really give us a good idea of what's going on. So if you don't know your skeletal anatomy, palpations are going to be really tough for you. So I'm going to show you real quickly some landmarks. We started last week with the lateral malleolus, all right? This is the distal portion of the fibula. Go up proximally at the fibula, this knot that kind of sticks out, this is our fibular head, all right? That would be an anatomical landmark. If you work medially from there, you have the joint line. If you come all the way up here, here's your patella, your kneecap. Just distally from your patella, going down, is your tibial tubercle, or tibial tuberosity. This is where your patellar tendon inserts. Your patellar tendon starts, kind of spreads out over your kneecap, inserts here. Some of you guys presented on jumper's knee or patellar tendonitis. This is where that occurs. All right. I can bend the knee up a little bit. If I come distally down here, find the tibial tuberosity. Medially, the medial joint line, that's where the medial meniscus sits. Laterally, right here is where the lateral meniscus sits. So if they have pinpoint pain just in this lateral joint line, they have clicking, catching, locking, popping, and a positive McMurray's test, positive Apley's compression test, that would indicate a lateral meniscus tear probably. All right, let me jump into a couple tests now. I think that's basically what I wanted to show you with the knee anatomy. ACL and PCL are deep in the knee. Okay, so lateral collateral ligament is here, inserts on the fibular head. Medial collateral ligament, put this leg down. Medial collateral ligament is here on the medial portion of the knee. Okay, I'm going to start out with a couple ACL tests that you guys read about, show you how to do those, and then we'll move on from there. So I'm going to have him flex his hip to about 45 degrees, knee to 90. That's a 90-degree angle here. What I'm going to do is take my thumbs, put them on his tibial tuberosity. Slide my thumbs out just a little bit, so slide them out. I'm going to grab back here in his hamstrings. One thing you can do is kind of massage the hamstring tendons back here. You can tell if they're really tense or really tight because they're apprehensive about you doing this test. So you can actually use this to relax their knee a little bit. So try to get them relaxed. You know, everything's good. Go to your happy place. I'll put my thumbs here. The other thing I do is I sit on the foot just so that this lower leg doesn't slide forward and give me a false positive test. All right, so I'll sit here. Thumbs here on the tibial tubercle, and I want to pull forward. You can see the thigh slide forward a little bit, but what I'm trying to do is get this tibia to translate anteriorly. All right, so I'm trying to pull the tibia this way. If this tibia right here at the tubercle comes forward more than this leg, when I do the same test on this leg, that would be a positive test, and that would show me he has some laxity, is what we call that, or some looseness in his knee. Okay. Posterior drawer test is the opposite of that. So I'm pushing, trying to posteriorly translate the tibia this way. All right, that would indicate PCL tear if that was more lax than the good leg. All right, let's get into the Lockman's test. Lockman's test is essentially doing the same thing, trying to anteriorly translate the tibia. I'm going to stabilize the femur, put my distal hand down here on the tibia, and I'm trying to anteriorly translate his tibia. He's got a good tight knee, a good end feel. The thing we're looking for in an end feel is when I translate that tibia forward, does it feel like it stops? You can feel something stop it. All right, that's what we want. That would be a negative test. A ligament that feels like it might keep coming and you can almost keep pulling it, that would be a soft end feel or no end feel at all. That would indicate a ligament tear. All right. Let me go on to valgus and varus stress tests. We talked about valgus forces with ACL tears this week. Valgus force is going to be a lateral force into the knee. So you can see this would be most common. Football, people falling into the outside of your knee is going to blow out or sprain your MCL on the inside of the knee. All right, so the way that we test that, I take my distal hand, place it on the inside of the leg here, my proximal hand. Really what I want is your proximal hand is your palm to go across the lateral joint line. You're just going to apply a valgus force inward. All right, he has a little opening in his knee, and I'll show you that on his other knee in just a second. One thing I do want to show you is also the varus stress test. And with the varus stress test, we're going to do the same thing, except I'm putting a medial force on the knee, looking for it to open up the LCL. So you can see he's got a little bit of movement there. I go to about 30 degrees and test that again, and that really isolates that quite a bit. All right, so let me show you that on the opposite knee and show you what that looks like over here. All right, valgus stress test on this knee. You can see it open up just a little bit here, a little bit more there. All right. The last test I want to show you is McMurray's test. Okay, McMurray's test. All I'm looking for is meniscal injury here. What I'm going to do is palpate the joint line here. I'm going to take his foot internally and externally rotate his tibia, internally and externally rotate his hip. So it'll be a couple different movements. I usually start out like this. What you're looking for is clicking, catching, popping in the knee. Then I'm going to internally rotate his hip, internally rotate his foot, externally rotate his foot, internally rotate his hip, then do the opposite. So I'm going to bring his hip out here, internally, and then externally rotate his tibia into full extension. What I'm trying to get is some clicking, catching, popping, locking, pain here that would indicate a meniscus tear. All right, so that's what I want to show you on the knee. The final thing I want to show you is just with hip movement. So the main thing I want to show you with this is we're talking about ACL landing strategies. I'll go back here, hopefully you can see this. What I want to show you here is that our hip movement should be the first thing we use when we're generating force. So if I'm a softball player in the middle infield and a ball's hit to my left or to my right, the first movement I want to be is from my hip. So we call these firing sequences. I want my gluteus medius actually on the outside to be the one to fire to get me there. It's going to get me to the ball quicker. It's going to stabilize my hips as well. If I'm a batter, I want to swing. I want to start my swing and get my hips through. You hear that term a lot, getting your hips through. If I'm a golfer, I want in my backswing my glute to fire first. And then once I get the club up, I want my hips to fire first on my downswing as well. All right, so every sport, basketball, if you're playing defense, I want to slide, I want my glute to fire. If I'm playing basketball and I want to step, dribbling, and I want to step, I want my glutes to fire. So glutes are really important. One really simple thing you can do for glute stability, a test, is just have someone go 90 degrees here at their legs, arms down to their side, close their eyes and balance. How long can they balance with their eyes closed? All right, if they start falling, airplaning here like this, that would indicate that their glutes aren't really stable. So we really want to work on that. And you guys have shown or talked about quite a few of those hip stability glute tests. All right, so the main thing we want to work on here is what are some specific functional exercises. A lot of you guys are talking about lunges, which that is somewhat a functional exercise, but if you think about it, how many times in sports am I doing this movement? So it's not truly a functional movement. A squat, a lot of you guys are using. So if I'm doing a squat, how many times in sports am I doing this? I'm exploding and jumping up, so that's a little more functional. But think about, so what are some functional movements that I'm incorporating into my athletics? All right, so that's what I want you guys to think about when this says functional activity. I want to do a live feed next week where you guys can ask me questions straight up from the computer, so I want to do that. Start thinking about a time that would work well for you. We'll try to work that out, and we can encompass everything we've covered so far before the midterm. So I hope you guys enjoyed this. Hope this is beneficial. If you have any other questions, let me know. We can chat on WebEx, or we can do another YouTube video. So let me know. Thanks.